Hi, my name is Sam Greenfield and I'm a physiotherapist practicing on the Gold Coast in Australia. And today I'm here to talk to you about dry needling. So what is dry needling? Well, the Australian Society of Acupuncture Physiotherapists define dry needling as needling to altered or dysfunctional tissue to improve or restore function. Basically, it's a form of therapy that uses fine, solid needles that are inserted into the various depths in the tissue in the affected area, which are then stimulated and left in place for a period of time. Dry needling can be used for lots of different musculoskeletal conditions. It can be used for joint or ligament issues, but is used mainly in the treatment of muscle pain. Muscle pain could be primary or it could be secondary to another condition. Any patient with primary or secondary muscle pain may benefit from dry needling treatment. The exact mechanisms of how dry needling works is not fully known. There is evidence to suggest that dry needling works both locally in the tissue and globally in the central nervous system. So when we insert a needle into a tender point of muscle, we're attempting to get a local twitch in that muscle. Stimulating the muscle like this can decrease the amount of pain chemicals in that muscle. It can decrease the electrical activity of that muscle, and it can change the oxygen and acidity levels in the local area. Centrally, we think that stimulation of the muscle will cause the brain stem to relieve pain-relieving chemicals and also inhibit nerve signals at the spinal cord level before they reach the brain and are perceived as pain. The best way to look at clinical evidence is a literature review that analyses lots of studies and summarises what they've found. Here are a few key studies published in the last 10 years. One study published in the Journal of Orthopaedic and Sports Physical Therapy in 2013 analysed people with upper limb and neck pain who received dry needling treatment. 12 studies were included in the analysis, and the study concluded from all the data that they would recommend dry needling compared to sham or placebo treatment for immediate reduction in pain, and they would cautiously recommend it for reducing pain at the 4-week mark. Another study looked at treating patients with neck and shoulder pain using dry needling treatment compared to sham treatment or no treatment. They included 20 trials and 839 patients in the analysis and found that compared with sham treatment or no treatment, dry needling was more effective at reducing pain in the first 3 days after treatment and at the 1 to 4 week mark. Interestingly, they found that other therapies, including physiotherapy, was superior to dry needling in relieving pain at the 1 to 4 week mark. Another review published by Physical Therapy Reviews in 2011 compared treating general myofascial pain with dry needling, placebo treatment, or standard care. There was limited evidence that dry needling combined with exercise is more effective in reducing pain than exercise alone. Overall, there is evidence to support the use of dry needling, although it seems that more high-quality studies need to be done to provide more solid recommendations. In my experience, patients that are appropriate for dry needling treatment will have immediate reduction in pain and will often have improved movement that may last a number of days, as well as reduced tension overall and a relaxed feeling directly after treatment. But to get an accurate measurement of improvement, we want to know about your pain intensity and the functional impact of your pain. To measure these, we can use 2 simple outcome measures. First, the pain scale, where we get you to rate your pain from 0 to 10. And the second is the pain disability questionnaire. It's a 15-question survey that asks questions about how your pain affects your everyday life. The benefit of these simple questionnaires is that they're quick and easy to use, but if we need more specific information, we might use a different questionnaire. Sometimes patients have a negative reaction, like soreness after needling, some local bleeding or bruising, and the occasional dizziness or fainting. More serious risks like infections, nerve injury, or puncturing lung tissue are very unlikely if the needling is done by a trained professional. This makes dry needling a very safe form of treatment. Before anybody receives dry needling treatment, it's important that all the risks and side effects are considered and the patient understands these. You may not be suitable for dry needling treatment if the following precautions apply to you: pregnancy, diabetes, anticoagulant medication, joint replacements, acute immune disorders, uncontrolled epilepsy, or active cancer. Okay, so I've brought my fiance Alicia in to help me, and we're going to do a little demonstration of how a dry needling treatment might work. So Alicia, we're going to treat your neck today. Now, we've gone through what we're going to do and how the acupuncture will work. Do you understand all this?
Yes.
Yes, good. And we've gone through all the risks and precautions, and you understand these and happy to continue?
Yes.
All right, great. Let's give it a shot. Okay, Alicia, so we've found that tender point in the muscle. I'm just going to prep the skin on both sides so it's clean and ready to go. Now, let's grab this needle. Now, if there's a twitch in the muscle, Alicia, you might feel a bit of an electric shock like feeling, okay? But that'll go away quite quickly. So that feels like I'm in the right spot there. This needle, that side. Oh, feel that? Yep. Yep. Here we go. So we've got a couple of good little twitches there. After treatment, we recommend that you follow the instructions of your physio to get the best outcome. This may include using simple stretches at certain times of the day, use of heat packs or simple pain medication post-session, avoiding certain postures after treatment, and following any advice on modifying activities. It's also important to mention that dry needling is not for everyone. If you don't think dry needling is for you, then you may consider using alternative treatments to reduce your muscle pain. Some examples are heat and electrotherapy, massage and pressure point therapy, joint mobilizations, or postural taping. Depending on the patient, your physio may decide to use a combination of treatments to tailor treatment to your individual presentation. So, if you have musculoskeletal pain, dry needling may be an effective treatment option. Once you've had a thorough assessment, you can make your decision with your physio about whether dry needling is right for you.